Well, and when it comes to Medicaid expansion, you're mentioning last time the governor's trying for this again. You rejected it last time. But considering everything that's happened with COVID-19, does that change this discussion?
No, I don't think COVID-19 changes the discussion on whether or not we need to have a huge expansion of welfare in our medical system or a Medicaid system. I don't think that really changes this discussion at all. It's really just what do you believe are the best ways to get access to health care for people in Wisconsin? And we've done things in the past to make sure that Wisconsin has great access to health care. And we've been able to do that without approaching it as a welfare expansion, which seems to be the governor's priority on this issue.
And as you know, Democrats wouldn't exactly call it that. But I'm curious, is that another thing then that you would say that's out?
Yeah, I don't think it's likely that we'll see support in the legislature for expansion of that particular welfare program.
The Medicaid expansion clearly is tied to so many other things. And I'm not just talking about the financial sanity of it. Clearly Medicaid expansion will allow us to recapture taxes that the Wisconsinites have paid into federal government without getting any return on it. But it's connected to making sure that we have a solid healthcare system in the state of Wisconsin, that we're addressing some of those disproportionate health outcomes that we have every place in Wisconsin, whether it's Black, Brown, Indigenous peoples. It doesn't matter. We need those resources, but we also need to have that connection to the Medicaid system so that we can accomplish these things. So that is a top priority. I know the Republicans call it welfare. It's not welfare. We've already paid for it. We've been paying for it for decades, and it's time for Wisconsin to join the vast majority of the rest of the country. Many of those are red states, and there's no reason why we don't.